Hey, Sarah, doing a mic check.
Sounds good. We can hear you loud and clear.
I'm ready when you are.
All right. Good morning, everyone. Thank you for joining us this morning on Monday, August the 2nd. Thank you for joining us for this media briefing to provide an update on the COVID-19 pandemic in the state. We have Dr. Lisa Piercey joining us this morning. She'll offer some opening comments and remarks, and then we'll have a short period for questions and answers. Please, when we get to that point, you can raise your hand virtually and I will call on you to unmute your microphone. Please leave your microphone muted if you're not speaking so that we don't have interference for those who may be recording or sharing this briefing as we go along. With that, Dr. Piercey, I will go ahead and turn it over to you.
Thank you, Sarah. Good morning, everyone. I've got several things to cover this morning, so let's jump right in. The first one I want to talk about is some good news, and it's about vaccine uptake. So I know we've gotten a lot of conflicting and confusing messaging over the last several days, but I want to be crystal clear. The vaccine is the single best tool we have to fight COVID-19. And how that plays into good news is that our vaccine uptake in Tennessee is up 22% week over week, from 62,000 a week to 76,000 a week. That means some Tennesseans, a lot of Tennesseans who have been hesitant, are now saying, you know what, I'm ready. And there's a lot of different reasons for that, but at the end of the day, are vaccinating more Tennesseans, and that is very encouraging. In fact, 94 out of 95 counties in Tennessee have seen a week over week acceleration in vaccine uptake. So if you're on the fence at all, if you think I might do it, I need to do it, I just haven't done it yet, I want you to reach out to that trusted voice, whether that's your medical provider or your pastor, your friends and family. Talk to them, and I hope you will join the thousands of Tennesseans who have made the decision recently to get vaccinated, not only to protect themselves and their families, but also the community. When we talk about vaccine, over the last several days, you've probably also heard a lot about breakthrough cases. And I want to set some important context because I feel like there's a lot of focus on breakthrough infections. And it's almost generating this sentiment of, well, if I'm going to get infected anyway, I'm not going to take the vaccine. It's important to keep in context what the breakthrough rate is. Our breakthrough rate in Tennessee is 0.18%. That is less than 0.2% of all fully vaccinated Tennesseans are getting infected. So to give you some raw numbers, we've had about 2.7 million Tennesseans vaccinated and 1,600 cases, breakthrough cases. So I don't want you to get in the habit of thinking that vaccine doesn't matter or that you're likely to get a breakthrough infection, because you're very, very likely to not do that. Breakthrough infections are rare, and when they do happen, they're generally not serious and rather mild. I will tell you, though, that 80% of the breakthrough infections in Tennessee that are hospitalized are in people age 65 plus. So if you are immunocompromised, you have a weakened immune system, and maybe you can't mount a normal immune response for whatever reason, or if you are of advanced age, you may be at higher risk and want to take other protections. But for the very vast majority of people, breakthrough infections are quite rare. Let me tell you about this surge in cases that we're having right now. Again, I don't want to sound like a broken record, but the vast majority of all of the infections happening right now are amongst the unvaccinated. Over 93% of all cases right now are amongst the unvaccinated, as well as 95% of deaths and 90% of hospitalizations. I'll say it again, vaccination is the single best tool we have to prevent COVID-19, both in ourselves and in our communities. As you know, we have had a very sharp uptick in cases over the last several weeks. We've had just a 204% increase just in the last week. We are still in that upward trajectory, and right now there are no signs of that slowing. Our 7-day average for new cases is 1,871, with a statewide positivity rate of over 13%. Now, I want you to know that these cases are all over the state, and they're predominantly the Delta variant. As I've mentioned before, we believe our percentage here mirrors that of the nation, which is 80+% of all cases now are the Delta variant. You know, that started in Tennessee, mostly in the Memphis and Shelby County market, mostly because of their proximity to Missouri and Arkansas. But now it is statewide, and there is no area of the state that is immune to the Delta variant, and it's not that's protected from not having that. It's everywhere. It's all over the nation. It's all over the state. When we see rising cases, we also expect to see rising hospitalizations. We now have well over 1,000 Tennesseans hospitalized statewide. And if you think back to the winter and when we had that big surge in December, January, February, our level of hospitalizations is now at about the level where we were in February. That is clearly the wrong direction. But again, the vast majority of those who are in the hospital are unvaccinated. And so if you're concerned about becoming infected, if you're concerned about being in the hospital, you need to take that very important step to be vaccinated if you haven't already. Something else our hospitals statewide are experiencing are quite a bit of capacity concerns. In other words, hospitals are starting to fill up. But it's different this time. We referenced how hospitalizations are similar to what they were in February, but now it's for somewhat of a different reason. Some of the same, some of a little bit different. It's not because they're overrun with COVID patients necessarily, but because they are having significant workforce and staffing challenges. You know, that's not unique to the hospital or the medical industry, but it happens to hospitals too. So in a combination of workforce and staffing issues, plus an extra burden of COVID patients, in addition to some conditions that we're seeing right now that we typically don't see in the summertime, things like RSV and parainfluenza. Those are respiratory viruses that we typically see in the dead of winter, and we almost never see them in the summertime, but we believe that all of the precautions kept them from having to flare up in the wintertime. We didn't see that typical winter surge last winter, but we're seeing it now. RSV in particular, but somewhat parainfluenza, particularly affect children. So we've got more children hospitalized now with RSV than we hardly ever see in the summertime. We also are going to start seeing an increase in our death rates. We're starting to see that uptick a little bit, but as you remember from previous surges, that is usually a 2 to 3 week lag. So I just want to warn you that we expect to see that in the next few weeks. And one more reminder, although we probably all remember, unfortunately, part of what happens when there are more infections is that we do our contact tracing here at the health department. That's something that we've done, we never stopped doing, but it probably may have fallen off your radar a little bit. So with increasing cases, you are more likely to be a contact, and therefore you are more likely to be contacted by the health department and notified, hey, you've been a contact, and they'll ask you some questions. Remember, if you've been vaccinated, you are exempt from quarantine if you are feeling well and not having symptoms. That may be another reason to get vaccinated. But I wanted to make sure that you're expecting a call from the Department of Health, or sometimes if we have a cell phone number, we're able to text you instead of call. If you are a contact, please answer that call. Please give information, and that will help us contain the spread. I also want to remind you that we will never ask for financial information. We will never ask for your social security number or any other personal information. And so beware of any scams that might do that, and please do not give them that information. I want to celebrate August as National Immunization Awareness Month. This is something not just for COVID vaccine, obviously, but all vaccines for children and adults. You know, it's easy to forget that there are lots of disease processes that we don't even have to think about and we don't have to worry about anymore. And when we were in medical school, we didn't even have to get much training on them because they're virtually eradicated by very effective vaccines. And likewise, we see the opposite. When there are low vaccination rates, even amongst routine childhood immunizations, these infections can come back. And I'll remind you of the 2019 measles outbreak because measles spreads very quickly. And there were some children that were vulnerable to that because they hadn't been vaccinated. And so that can be very scary and it can move very quickly. So I want to take this opportunity to remind parents, you know, a lot of parents and families got behind on vaccinations throughout the last 18 months. That's normal. It's okay, but it's time to get back on track. So if you have a child who is behind on their routine immunizations, I encourage you to call your doctor, get your child back in, get caught up on immunizations. And don't forget, immunizations aren't just for kids only, they're for adults too. And you may not realize that there are some highly recommended vaccines for adults, particularly as we get older. So take your child for a checkup. Go yourself for a checkup. Don't forget about the importance of routine medical care and routine immunizations, not only as we celebrate National Immunization Awareness Month in August, but all throughout the year. And finally, a couple of comments on back to school. We issued our updated K-12 guidance last week. I will tell you that it's pretty much the same as last year. We've updated a few things, most notably is something I referenced just a minute ago, which is vaccinated individuals are exempt from quarantine as long as they're asymptomatic. But the rest of the guidance primarily reflects CDC recommendations. Health departments will continue to do contact tracing for schools. And so if you are contacted because your child may have been exposed at school, again, I encourage you to answer that call and participate in that process. There are a lot of school districts right now that are contemplating mask requirements. I will remind you that that is a local decision for school boards, and there really is not a one size fits all policy. This is something that school boards need to decide what is best for them in their communities. However, that needs to be decided in the context that vaccine is available for children down to age 12, and vaccine is very effective in preventing that, as we've already discussed. And likewise, masks do protect unvaccinated children. Finally, I know that today is the first day back at school for a lot of kids statewide, including my own. And so I just want to wish everyone a very happy and healthy school year this year. Happy to take questions if you have any.
Thank you, Dr. Piercey. We will turn to Brad Broders with WATN in Memphis. Brad, if you'd like to unmute your mic.
Hi, thanks. Hi, Dr. Piercey. Dr. Piercey, what would you kind of big picture? I know in Shelby County here in Memphis, the vaccine rates have improved the last 3 or 4 weeks, but also the surge in cases. What would be your kind of where Shelby County is with vaccines versus the surge in cases, your overall thoughts about Shelby? And is there anything new that the state hasn't done in vaccine outreach that it might plan to do this month? Thank you.
Yeah, thanks for those questions, Brad. I don't have any specific things in mind for Shelby County. You're right, vaccines are up, cases are also up. We need to continue that outreach. We need to continue getting as many people vaccinated as possible. You know, the thing that bothers me not only about Memphis and Shelby County and its proximity to the continued outbreaks in Missouri and Arkansas, but also statewide, is that we are still in a very steep upward trajectory. So far, we have not seen any signs of slowing. There are some indications that this may slow down in a few weeks based on some experience overseas, but there's no guarantee of that. And so we have to put all hands on deck right now to make sure people are protected. And as far as sort of new and different things, specifically, we are looking at counties with low vaccination rates and charging up our efforts to promote vaccine in those areas. Now, you know, I don't suspect there are many people in the state that don't know about the vaccine or that don't haven't already made that decision in their heads or at least gotten the information. But we're going to remind people this is still the single best tool, because a lot of the messaging that's been coming out makes you think, well, is it even worth it to get a vaccine anymore? And we are unequivocally telling people, yes, absolutely, it can save your lives and those of those around you.
Next, we'll turn to Caleb Pernay with WCYB. Caleb?
Hey, Dr. Piercey, I wanted to ask you about with the school systems. I'm not sure what's happening statewide, but up here in Northeast Tennessee, I'm not aware of a single school system that plans to follow the CDC guidelines for schools. Particularly, I haven't heard of one that's going to require masks. And at least in one case, there was a school system that said they were going to try to avoid quarantining kids. So I guess I wanted to ask on the state level, what's your advice for them, and is there any kind of talk or consideration of requiring a certain level of precautions in schools?
Yeah, that is a hot topic, Caleb. Thank you for asking about that. So, from an authority standpoint, the school boards have the authorities to make decisions locally. And you've heard both the governor and me talk about the importance of local decision making for a year and a half now, because what works and what is current in Giles County may not be the same as what's going on in Tipton County. Disease burden is generally not the same everywhere all the time. And likewise, parent sentiment, disease spread, different activities, they're different in different parts of the state. That's why it's really important for those decisions to be local. And so we're not going to be issuing any state level guidance on that. As you mentioned, both the CDC and the AAP have recommended masking in children. And so my encouragement to school boards is to look at those national sources to remind parents that children down to age 12 can be vaccinated, and that's the single best tool we have. You know, this time last year, we didn't have that tool. And so it's really incumbent upon us, for those who are able to get the vaccine, to encourage them to do so.
Next, we will turn to Kelly Roberts with WMC in Memphis. Kelly?
Hey there, good morning. Talking about hospitalizations, when we're seeing the issues that we're seeing when it comes to patient load and staffing issues, would there ever be a time that the state would call in federal help, or any thoughts on the overflow site, especially in Shelby County? Would that ever get called to reopen? Also, what indicators, can you explain the indicators that you're seeing that tells you that this thing isn't slowing down? Thank you.
Sure. So related to staffing, there are very few times where hospitals and healthcare systems function and operate like general retail businesses or other businesses, because they're just sort of different, they're completely different industries and sometimes feel like different universes. But in this scenario, hospitals are experiencing workforce shortages just like every other business that you walk into. And hospitals are not immune to that. And when you're looking for those really highly trained, professional, and licensed staff, it's a very competitive environment. So our hospitals are doing everything they can. We're trying to support that on the state side with regulatory flexibility, talking to hospital partners on an everyday basis to see what we can do to support their staffing needs. We did start some conversations towards the end of last week with some federal partners that may have staffing resources. We will certainly take advantage of absolutely every resource made available to us through that channel. Related to what you said about the alternative care site, or some people call that a field hospital, which we had one in Memphis. We don't anticipate needing that, because that's when you get in a crunch for physical space. We've got enough physical space and physical beds right now. It's the staffing that we need. We can even put more people, and we've got 2 or 3 more levers that we can pull on the hospital side of things to put more patients in the hospital. But as you've heard me say many times, particularly last winter, if you can't put a staffed professional, if you can't staff a professional at that bedside, having the physical bed there doesn't really matter. The other question that you had is about all the metrics and the trajectory. We continue to see very steep rises in both case count and hospitalizations every day. We haven't yet started to see that plateau. And so we're watching it just like you guys are. And I'll feel a little bit better when that rate of rise starts to level out a little bit, because generally you will see a plateau before you start to see a decline. We are not yet at that plateau stage. We are still in the upward trajectory.
Next, we'll go to Blake Farmer with WPLN. Blake, unmute your microphone. Thank you.
Thank you. Dr. Piercey, I wanted to ask about nursing homes. I was looking at some of the latest info from your nursing homes, and it looks like at this point you've got far more employees, staff who are testing positive than patients. Can you talk a little bit about that, and whether there's any, sort of push to, kind of circle back to those folks with vaccination?
Sure, that's a really important question, Blake, and I'm glad you asked it, because it hits directly at what our focus has been throughout the entire pandemic, which is vulnerable populations. And there really is no more vulnerable population than those frail, medically fragile, elderly folks in our nursing homes and long-term care facilities. And you're very astute to note that most of the cases in nursing homes right now, and all long-term care facilities, are amongst staff. And that's because the vaccination rates in nursing home and long-term care staff really mirror that of the community. I wish that were different. And I suspect that you assumed that it was a lot higher. It is marginally higher than the general population, but at best, most nursing homes have around a 50% staff vaccination rate, sometimes a lot less, particularly in rural areas. Again, just reflective of that community vaccination rate. Likewise, not all of the residents statewide are vaccinated. They've all been given the opportunity. We've got, plus or minus, generally speaking, statewide, about 80% of our nursing home patients that are covered. So we've still got vulnerable patients, but we have a lot more vulnerable staff. And so we're working with not only our long-term care task force, but also the association and our providers and just our friends in the industry to say, hey, can we come out and do a strike team and bring vaccinations to your staff? Many of them, however, already and still have their federal pharmacy partners that they used back in January and February, mostly CVS or Walgreens. And so those partners are coming on site with some regularity to vaccinate new residents or new staff. So the staff has pretty good opportunity to do so. We just encourage them to take that opportunity.
Next, we'll turn to Stella Yu with the Tennessean. Stella.
Hi, Dr. Piercey. So I have two parts to my question. The first one being, so you've said it's unlikely for the unvaccinated at this point to not have received the information or not to have access to vaccines. And the department has talked about continued vaccine outreach. How exactly would the department, effectively encourage vaccines among unvaccinated who either still believe that vaccines are probably harmful or ineffective? And that's the first part of my question. And second of all, generally, have you seen any geographical trends in terms of case upticks in the state and, vaccine uptake? Thanks.
Sure. So to answer your second question first, this time, as opposed to times in the past, is pretty uniform across the state. It started in this last surge started in the Memphis Shelby County market, again because of the proximity to the other states' outbreak, but it pretty rapidly spread across the state. So we're seeing it pretty uniformly, with a little bit more predominance in metro areas than in rural areas, but again, that's just because of population concentration. We are not seeing a lot of variation in vaccine uptake statewide, but as I mentioned, almost every county, well, all counties except one, have had an increase or acceleration in their vaccination rates over the last 7 days. So that's encouraging. But to get to your first question, which is how do you get to those people who are still thinking about it, are still hesitant, and I don't really have a new answer there. We just have to continue doing what we've been doing. And that is making sure the information is available and making sure we get that information not only to those who are unvaccinated, but to the trusted sources who can help that person make their decision. You've heard me say no less than 1,000 times that the government is not who people trust and look to for medical advice. That's okay. That it shouldn't be. It should be their doctors, and it's going to be a very common thing for when you walk into your doctor's office. If you're unvaccinated, they're going to ask you, have you considered this? That's a perfect opportunity to ask any of those questions. You know, some people get nervous about asking their doctors questions. Let me tell you, any doctor you talk to will tell you, we've heard it all. So ask them. Don't be afraid to say, you know, it might sound crazy, but I heard this might happen if I get vaccinated. Your doctor, your medical provider will be able to tell you whether or not that has any validity and how that impacts you and your own medical conditions. So I encourage you to talk to your doctor. Again, I sound like a broken record, but that's the most important source. I do have one other thing that maybe we can do a little bit differently than we have in the past. We need some pretty straightforward messaging. We need to tell people, look, if you're vaccinated, you are almost never going to be in the hospital or to die if you get infected, unless you have one of those really high risk conditions. We need to tell people, if you are vaccinated, there's not a really compelling reason for you to wear a mask if you are not around high risk people. And so we need to start focusing our message on, hey, this is what works, not all of the reasons it might not work, because we know that this is the best tool that we have, and we need to confidently tell people that.
All right, our last question for this morning is with Jackie from Fox 17. Jackie.
Hi, Dr. Piercey, you mentioned the importance of local decision making as far as school boards go for mask mandates and things like that. But the governor did strip county mayors of their ability to issue mask mandates and other public health orders back in April. Do you think that's something that should lie for county mayors or something that should be reversed?
I think every single employer, every single individual, every single community can make that decision for themselves. I think the day of government mandates is over, and you're seeing that nationally, whether that's at the state level or the county level or even the federal level. There's just not a lot of appetite for that because people aren't paying attention to that anymore. But what they do pay attention to is when you go into a place of business, when you go into your employer, if they want to do that for their private business, then customers can respect that, employees can respect that. But I think the day of big government mandates is over.
All right, thank you, everyone. That concludes our briefing for today. We appreciate you joining us, and we'll end the call. Thank you.